All right, we just have a few more connecting to audio and we will get started here pretty soon. I'm glad to see y'all all here. Try and get all of my screens together here. All right. Well, it's 1 after start time, so I guess we can go ahead and get started. I know some are maybe still joining from other sessions, and it looks like some are maybe working on getting connected to audio. So I want to start off with a quote from Melinda Gates, and if you're not familiar with her, she's the co-founder of the Gates Foundation and former partner wife of Microsoft founder Bill Gates. And she said, if we want to include everyone, we have to help everyone develop their talents and use their gifts for the good of the community. That's what inclusion means. Everyone contributes. As health literacy professionals, a part of our mission is to promote health equity, and health equity is even tied into the theme of this conference. But if we don't engage the hard to reach populations, we risk creating materials that work well for those with strong literacy skills or better education. And that could leave behind some of our other really important audiences, which are often minority or low income groups, and this just perpetuates health disparities. So today, Anita and I are here, and we will be telling you about some strategies we use to field test materials with community members. Anita has been leading this work at CHL since she joined a few years ago, and this work was actually a part of my role when I first started at CHL back in 2016, and I've worked with Anita and a couple of other team members to continue to develop our field testing work since I've been here. So during this workshop today, we're going to talk about the importance of engaging the right audience through user testing and talk about some strategies to engage those who may be harder to reach. To do this, we'll talk about the rationale for engaging in this work. Then we'll discuss strategies related to recruiting the right audience and engaging them during the field testing session. And then we have some activities designed. This is an interactive session. We really want to hear your thoughts about this, because we know that as professionals in this work that you have probably great ideas to share. So this is a great opportunity for all of us to learn from one another. So with that, let's go ahead and get started with interacting with one another. So you can put this in the chat, or I'd also love to, if you unmute and want to share your thoughts out loud. But why do y'all think it's important to get feedback on written materials? Or maybe just materials in general?
One of the things we found here at the health department is when writing something, we might think it's easy to read, but then we give it to another coworker and they're like, wait a minute, this is still too complicated. I don't understand what you're talking about. So without that feedback, it would have been put out there and half the people wouldn't have been able to understand what we were saying.
Right. Yeah. It's great to talk to some of those people, right, in your health department. And it's so great to get different perspectives on what other people think. What else? So it provides like a different perspective.
And we have a couple of answers in the chat as well, too.
Awesome. It's hard for me to see with
Yes. Yeah, so Kimberly said to ensure our audience easily understands our message. Very good. Margaret said to understand your audience reading level. And Elizabeth says we may think something makes sense, but to others it doesn't. So kind of some of the points that we were making, and then to evaluate the effectiveness of our material.
Yeah, so you can even work into that field testing session about, how well the messages are getting across to your participants in field testing.
And we also have Karen says to understand our audience need and if the resource meets their needs.
Yeah, I like that one too. Sometimes it's not just testing the materials. Sometimes we're getting feedback kind of on our ideas, right? Of what we're thinking we might need to put out, but sometimes we learn from our field testing sessions that we didn't really know what our audience needed out of on a certain topic. So kind of use it as a formative. How does this help y'all? Like what do y'all think the outcomes are of this? I'll tell you one outcome that I think that this is kind of one of my favorite stories to tell about on myself. When I started at CHL and our founding director told me that I was going to be, in charge of this, I went, yeah, well, that's like a nice thing to do, but I think it's going to be fine if we didn't do it. Like that was kind of my attitude towards it. And it was really, really hard. It was hard to get people in the room, get the right people in the room. And but what I learned really quickly is the kind of feedback that I got from them was like boom, like mind blowing. So that was really that was a good humbling experience, I think, for myself. So somebody also mentioned in the chat that ensures health equity, absolutely. Yeah, and Sean mentions ownership by a focus population you're trying to reach. So that probably like helps with trust and things like that too. All right. Well, if y'all don't have anything else to add, I can go ahead and share what I think kind of the reason is for this work. And I'm sure that everybody here is well familiar with this stat that over 80 million Americans may struggle with health information according to the National Assessment of Adult Literacy. And of course, this leads to poor outcomes. People are more likely to go to the emergency room instead of use preventative care. They're more likely to be hospitalized, leading to higher healthcare costs and poor health outcomes, and maybe even higher mortality as well. And somebody else in another session was kind of talking about this too, of how health education materials are just not optimal. And there's numerous studies out there that say that patients and consumers like just don't understand them and that they're too difficult versus even our own metrics. And I have just a few on the slide that I just kind of found as examples. So the first one here on the slide is Hoang and colleagues assessed hundreds of patient education materials from various associations and found that readability ranged from the 9th grade well into college reading levels, and more than 80% of the materials were above the 8th grade reading level, which the Joint Commission would recommend that they be below that. In addition, they did some analysis of like longer and more uncommon words and found that more than 25% of the words used would be characterized as unfamiliar. The next one here is from Cavallero and colleagues, and they evaluated consumer information about COVID materials online in March of 2020. Did readability and PMAT, which indicated that the materials weren't optimal. Only 2 of the 28 assessed at a 6th grade reading level or below, and more than 50% were at a 10th grade reading level. And the PMAT, the average understandability score across those materials was a 70%. And the actionability was indicated to be a bit better at 79, but not that great. And then Holler and Friends assessed nearly 100 urogynecology documents for readability, understandability, and actionability, and only 1 met plain language standards, and none were considered to be readable. And then Snakel et al. Assessed some ortho documents and found similar issues with them. And again, these are just 4 studies that just random found. Field testing is known to help enhance understandability of materials through feedback from an intended audience. And this is a widely promoted idea in many industries, including marketing and communications, web development, tech and software development, and even beyond that, AHRQ, the Agency for Healthcare Research and Quality, recommends that field testing of materials through the Health Literacy Universal Precautions Toolkit, and it's also noted as a standard plain language best practice. AHRQ also takes their recommendation just a step further to say that field testing should include diverse audiences. And to me, this not only means that we include those who are racially and ethnically diverse, but also include those who are more likely to struggle with health information. If we can make health information easy and understandable for those who struggle the most, then we're more likely to reach our audience. But I'd acknowledge that there are certainly barriers to engaging this group of people, and they really, to me, aren't necessarily that different than just in general engaging participants in research. You know, people don't come to these things because they have limited amount of time to dedicate to, you know, everybody's busy. Everybody, you know, you have work and or family activities or friend activities, you know, so coming to something like this, coming to a field testing session might not be something within your time frame. It can also, that can be inconvenient. So it's not only just inconvenient time, like maybe the time of day doesn't work, but also just can't get there, for whether it's get there online or get there in person. People might just kind of lack confidence in their own skills and feel like they couldn't contribute anything. And that's kind of a barrier to them wanting to come to that. And then they also just might distrust systems and organizations, like you're from someplace and I don't know you, or you said something I don't like before, and so I just don't trust you. And unfortunately, those who are more likely to struggle with health information may also feel just uncomfortable, you know, providing feedback to improve written materials, and therefore just might self-select out of this type of activity. But overcoming these known barriers is a step towards, as y'all pointed out, health equity, as populations with known health disparities demonstrate challenges with health literacy. And when we engage members of our audience who may struggle with health information, we ensure that information is easy to understand. So it's helping us reach at-risk populations who are more likely to misinterpret our instructions. It gives us some valuable feedback, as I talked about a little bit ago from my personal story. It promotes health equity, as we've discussed. Testing with these populations ensures that our materials are inclusive and usable for everyone. And it helps us achieve better outcomes, better health outcomes for everyone, and all hopefully minimizing costs. So I went through that quick, and I'd love to hear from y'all again. What else would you add to this rationale based on your work experience? Why else would this be important? Anita, what do you find most important about it?
It just improves the materials. It improves the quality of material. Yeah, improves efficiency. That's what I said. I think, like you were saying, when I didn't even know what to expect in the first ever session that I've attended, and I was actually working on a project as well too. And some of the information that they provided, I was like, well, never thought about it like that. So it was very an eye-opening experience for me.
I think, Margaret, to your point too, of like just being efficient, it's, we continue, we put new materials in front of people and we learn things, that help us not only improve that one document, but also that we take forward and, as we work on, the next project or whatever. Anita, I think one of the things too, that it might not be necessarily part of this rationale, but I just love meeting the people.
Agree.
And
And we
that
have some great answers in the chat as well, too.
Yeah, it so helps with individual health literacy too. Like, so maybe they learn something from the session that they take away, from them. They get kind of some exposure and helps achieve goals in becoming a health literate healthcare organization.
And I really like the cultural perspectives. I agree. For me as well, too. Being, not being from here, I get a different cultural perspective on, certain things. So, just engaging with diverse, and like it goes back to knowing your audience. Who is this material intended for? So, I think those are great points.
Ray, I like your point too about if audiences know that the materials were developed with people like them, they may be more likely to engage and think like, hey, this is for me. I got a follow-up question for that. How do you let people know that? Like, are you putting something on your materials that say it was, we got people's feedback? Should we do that? I mean, maybe is anybody doing that? Should we do that? I've just never thought about that. While y'all kind of munch on that, we can go ahead and let Anita get started with our next section.
Yes. So now we're going to talk about some strategies to recruit participants who are more likely to struggle with health information in the field testing sessions. So we want to start by recruiting the right participants. So what does that mean? Who are the right participants? So the right participants are the ones who are likely to struggle with the health information. So who are those who are likely to struggle with information? So we have here a couple of categories. We have the underrepresented racial and ethnic groups, the people with limited education, the low income people, and adults over 65 years old. And I think one of the lessons from COVID, I think we were able to identify this group of people, and they were the ones that struggled a little bit more with the information. So these are the population, the people that we want to include in our focus groups. So before moving forward to our other strategies, we do have a little breakout activity. So what we're gonna do, we're gonna start off by, in this activity, we're gonna talk about recruitment planning. So we're gonna start off by brainstorming on your own, where you might go to recruit participants for field testing. Where can you find participants who are more likely to struggle with the health information? Then after a few minutes of individual brainstorming, everybody should share at least one place that they think they might can find the population with the group. We will gonna come together and discuss. Katie and I are gonna float around the rooms to be available for questions. I am going to put some instructions here in the chat, so we kind of all are on the same page. So I just think about this. And then Katie, how many groups do we wanna do?
Sorry, I muted myself and it's hard for me to find all of my controls here still. So it looks like we have 35 less us three, Mario, you and I. So I think our original plan of 4 groups is probably Okay,
Or group.
we're gonna have 10 minutes, right?
Correct. So I'm creating the right now. I'm gonna put 10 minutes.
I will also stop my share for the moment, if I can figure that out.
Working my magic. Okay. And I am gonna go ahead and open all rooms. So everybody should automatically go to their rooms.
You want me to take 1 and 2 and you take 3 and 4?
Yes.
All right, I'll go ahead and go to.
I'm gonna join room number 3. It looks like there are 2 that they weren't assigned for some reason.
I just joined, sorry.
No, you're okay. I can put you in. Put you in room 2. Mario, it's not letting me. Can I put them in a different? Can I put them in a room?
I'm not sure. I'm not sure if it'll allow you to put them in rooms yourself. I think. Let's see here.
Or can they click on something to join a room?
They can click on breakout
Okay.
rooms and then they can select the room
Yes.
with the blue join button.
Okay. Miss
So-
Andrea, if you
so-
want to click on room 3, are you able to see the rooms?
No, I don't see the rooms. Where would I look for those?
Yeah, on the bottom of your screen, click on the breakout rooms icon. That'll open up a window and then it'll show you the rooms with each room will have a blue icon next to it.
Mhm.
Cool. Okay.
Thank you.
You're very welcome.
The stuff I have open. Okay, well, how about in the chat, if everybody can share, one person from each group share, like, what did y'all come up with? Where might you recruit the group? Or you feel free to unmute if you'd rather talk. That's cool too. Karen mentions places of worship. That's great. Library.
Yeah, our group talked about using like CHWs because they're in the community, cultural brokers as potential, as well as, you know, depending on who you're wanting to, or who the materials or things are for, surveys and et cetera, you know, like working with the local aging and disability resource centers, things like that. If you're reaching seniors, reaching out to literacy agencies, of course, if they're in your area.
That's awesome. Good work. Did anybody else have anything different? We have community partners, refugee organizations. Another group that says places of worship.
Yeah, so we had a good conversation in ours to just kind of, you know, somebody was saying that in California, you know, Margaret's Farm Workers organization there too, you know, so we don't have as much here in Arkansas. I was telling them, so this is kind of good to know your audience, you know, and who are the materials targeted towards. So I think that's great because you have a variety to recruit from.
All right, well, we can go ahead and move on and share some of our ideas anyway.
Yeah, so this is just kind of possible recruitment location. These are the locations that we kind of, went to, and some of you all mentioned that. And it kind of goes back to thinking of where we can find those groups of people who are likely to struggle with information, with health information, free clinics. They're the people that, with low education and, low income. Senior centers, people over 65. So whenever you are going to these places, think about trying to keep in mind of that kind of population that's going to be there. And I think it's been some great conversation coming about it. But okay, so we're knowing what kind of people do we need to recruit, the possible location, but we also have to screen them to make sure they are the appropriate participants for us. So we can screen them by using a validated screener test. You can choose screeners and you have a few options that we have here on the screen is it's the single question screener answering. So we have the questions over here is how confident are you at filling out medical forms by yourself? So we have extremely, quite a bit, somewhat, a little bit, not at all. This is validated against the short test of functional health literacy in adults and the rapid estimate of adult literacy in medicine. Just from personal experience and all that, this one, sometimes people are not always going to give you maybe the appropriate answer. Just because they might not feel, they might tell you what you want to hear, or they might not be embarrassed, or they want to not kind of tell you exactly the truth. Another screener is the MBS, which is uses an ice cream label and asks 6 questions. The MBS might take a longer time, and you're giving participants about 3 minutes to answer 6 questions. And this is validated against the test of functional health literacy in adults. So now we have a fun activity planned. We actually gonna try to do the MBS by answering 6 questions. We're gonna put the ice cream label in the chat. Thank you, Katie. So, and on a piece of paper or opening other Word document, we invite you just to kind of write your answers to the following question. You can say yes or no. You will have 30 seconds per question, and Katie's actually gonna time that. So when the 30 seconds are up, we're gonna move to the next question. So as a reminder, this information is on the back of a container of a pint of ice cream.
Is everybody ready? Do you have something you can write 1, 2, 3, 4, 5, 6 and put yes, no next to it? Speak now or forever hold your peace. I put the ice cream label in the chat. You can open it, but it's also going to be on the slide.
Yeah.
All right. I think we're ready. I'm going to try my best.
Okay, so the first question is, if you eat the entire container, how many calories will you eat? So you have 30 seconds to answer this question. And you don't have to put the answer in the chat. You can keep the answer for yourself. I like it though. It's a very good.
Next question.
Okay, next question. If you are allowed to eat 60 grams of carbohydrates as a snack, how much ice cream could you have?
Write on your paper. Next question.
Your doctor advises you to reduce the amount of saturated fat in your diet. You usually have 42 grams of saturated fat each day, which includes 1 serving of ice cream. If you stop eating ice cream, how many grams of saturated fat would you be consuming each day?
Next question.
If you usually eat 2,500 calories in a day, what percentage of your daily value of calories will you be eating if you eat 1 serving?
Next question.
Pretend that you are allergic to the following substances: penicillin, peanuts, latex gloves, and bee stings. Is it safe for you to eat this ice cream?
Next question.
This last question is only if you answered no to the last question. Why not?
All right, that's it. Time's up. So I guess we can move on to the answers.
Yes. Okay, so here are the correct answers. So if you answer correct, you're gonna give yourself a 1. If you answer incorrect, you're gonna give yourself a 0. So the answer for the first question is 1,000. This is the only correct answer. For the second questions, any of the following is correct. So 1 cup of any amount up to 1 cup, half the container. So, you know, here, if the participant answered 2 servings, ask how much ice cream could it be to measure into a bowl. And then the third one, 33 is the only correct answer. And then on 4 is 10% is the only correct answer. And the last 2 question, it's not safe because it has peanut oil in it. So
Tell your what you got right.
correct.
And so you can certainly share if you want to. But if you got 4 to 6 right, the screener says that almost always indicates adequate literacy. If you got 2 to 3, indicates possible limited literacy. And 0 to 1, high likelihood of limited literacy. And Ray says in the chat, did the math wrong on number 3, and so I only got 5 out of 6. And I understand this. The
I
math
can
is
relate.
hard.
I'm not a math person, so I could relate to that.
Yeah, good comments on that.
Yeah,
Okay.
so definitely, it's not an easy activity, you got some time constraint, you're under pressure to do some things. And we have a few tips for administrating the MVS. So it's an activity that we do with all our new participants. When we are trying to introducing like, oh, this is a fun activity, we're trying to make the participant feel comfortable when they're doing the activity. It is very important that you only allow 30 seconds per questions because, if longer, that's not fair and it's not going to get an accurate result. Don't respond to their answers. You all did it too in the chat. You kind of put the answer and kind of everybody starts. So I try to have a poker face when I do that. And I said, okay, let's move on to the next question. If they don't know the answer or, they're kind of looking at you to tell them the answer or just kind of get some response, just be like, oh, yes, let's move on. And you don't need to tell them the answer or the score. Just like I said, we find it better because maybe they're going to make them feel in a certain way. So in this way, you're the one that's kind of keeping up with that answer and just make the total at the end. So, and also kind of reassure them at the end that all answers are good answers. Sometimes you might get just very random, answers, but it's just, part of it.
I've had people just tell me, Skip, I don't even want to attempt to try to answer that question. And that's fine too. That's cool. All right. Well, let's move into the next bucket that we're going to talk about, which is planning for the session. So, and we're right on time, which is awesome. So we all know that those who struggle with health information likely, could struggle with the things that we're asking them to do in our session. So we need to consider the skills of our participants. And so when we're people who are likely to struggle with health literacy might lack some prose skills, which are those reading skills. They might have trouble filling out forms. So I don't know, but working for a state entity, like we have some required forms that we have to get them to fill out, and we don't always have control over what those say. So, but we have to, keep that in mind as we're engaging this group of people. We also know that people may struggle with digital skills. So if we're engaging folks over in a virtual session, that might be something that's challenging. And we know from the National Assessment of Adult Literacy that those with inadequate health literacy couldn't use a map, to find a location, and they also struggled to use charts and things. So consider that as you're engaging with these people. And so one of those things, since we're considering our audience, is that we always want to make sure that we are clearly communicating whatever our expectations are, whether it be that they're there at a certain time, that they don't have caregiving responsibilities for virtual sessions, that they're on camera and not driving, or that they're in a quiet place. We need to clearly communicate that with them. So our plain language best practices can't stop at the the material that we're putting in front of them. We have to put in our plain language, do all of our due diligence when we're communicating with them. In the previous session I was in, Grace and Sabrina were talking about, it's not just that materials that we're trying to write, but it's all the other communication. It's important that we use all of our plain language tips when we're around recruitment and reminders and instructions. I have some of our templates that we use for our virtual sessions to help remind them, like, this is the time you're going to be there. And if it's a Zoom, here's your link and the passcode, and let them know what they're talking about. And it gives them all the instructions. So one of them is just an excerpt of a reminder letter, and then the other one is just the day before email letter. So the first one's kind of like confirmation, the second one's like a day before reminder. So as we plan for the session, we need to also prepare our space, and how we prepare it might depend on if we're meeting in person or virtually. We've done our sessions both ways, and they're both have, pros and cons. But either of the formats, you want to make sure that you're there early, because sometimes we'll have people show up, for a focus group session in person like 30 minutes early, because they just want to really make sure that they're on time and that they don't miss something. They're like really excited to participate. And this way you can be there to greet them and just help them find their way or log on or whatever. In person, it's good to have wayfinding signs and instructional signs in the room, and a good room setup. I tend to like what was always referred to me in grad school as the happy horseshoe. So it's a U, and you can, stand in the front and kind of walk around to all the participants and talk to everybody. Treat them as a group, but then also kind of have more personal conversations too, because they're not just like at little tables or something. For virtual, we like to prepare our space by doing tech checks. We've found these to be super important. I know that we are all used to Zoom, although it doesn't seem like I am today because I'm kind of struggling. Or maybe you're using Teams or whatever. But that, just because we're used to it, because we're here, using Zoom in our professional lives all the time, doesn't necessarily reflect everyone's experiences. So when engaging with those that struggle with health information, knowing that they might struggle with technology too, having some tech checks is really important. And our tips for tech checks, that's hard to say, can't say it too fast, here on this slide. We try and emphasize with them that we want them to use the same device for the tech checks that they're going to use the day of the session, because we're basically there helping them set it up. We try and troubleshoot like each step of the way. We talk to them about how to turn their camera on, because we want to see them, because body language and kind of facial expressions can be important. You can tell if somebody's like questioning something and maybe you want to ask them about it. We obviously need to hear what they have to say, or they can't give us feedback. So we want to make sure that their mic is set up and worked, and that they can hear us as well. And then we teach them how to use features in whatever we typically use Zoom. But if you're using Teams or some other platform, you got to teach them how to use the chat. And if you're going to have polls or any other features they might need to know, like raising their hand, just helping them get comfortable with the setting. And then somebody in one of my groups mentioned providing incentives, and that's another way we plan for our focus group. So there's lots of different types of incentives I think that you could offer, depending on your format. Again, of course, gift cards are potentially a good incentive. Could also provide a meal, especially if you're going to do this like over a lunchtime or a dinner time, like at a meal time. That might be a great thing to do. Some considerations when giving incentives: you got to think about your institutional policies, because we work for a state entity. We have to collect Social Security numbers, and that can be kind of a barrier for people, like, obviously don't want to give out their Social Security numbers, or in some cases, they don't have Social Security numbers to give out. And so we have to make considerations for that. Ethical considerations: we want to make sure that we're giving them enough money for their time. Like, is it enough? We want to be equitable and respectful of people's time, and just make sure that we're giving them a fair amount for what we're asking them to do. And then another thing to consider is if you're using grant funding to give incentives, some grants don't allow that. And so you might have to have your own little pot of money for incentives. So have another little group discussion. So what have y'all done in testing to make sure that your environments are welcoming and accessible to all of your participants? You can put it in the chat or feel free to unmute. about giving, um, giving gift cards. I think you mentioned Target gift cards, so this is Arkansas, we're in Walmart world. And so we give Walmart gift cards because there's a Walmart everywhere here. Dollar General, like, I don't know if Dollar General is prevalent everywhere in the United States, but it seems like there's one on every other corner. And so that could be a good one too.
And also, I think with the amount is important as well too, you know, just kind of make sure they're being reimbursed and for their time. I think we kind of discovered that too.
Yep.
Yeah, we
So-
actually talked a little bit about that in our group of really compensating people for the knowledge that they're bringing to the project. And I would recommend giving cash instead of gift cards if you're able to, because then they can use the money as they need to. If you give them a Walmart gift card, then they have to buy stuff from Walmart.
Yeah, we talked about that too. Just give him like maybe a general gift card, you know, in this way people are not limited to just that. Because I'm not a Walmart shopper, you know, I'm more like, you know, Kroger, so it all kind of depends.
We are not allowed to give cash at all.
I don't
Uh,
think we would be able
yeah.
to either.
It looks like there's somebody said hosting at spaces are familiar, comfortable with. I think that's
Yeah.
very important for people to go to the places that they know, they feel, you know, transportation. Yeah, I think that's, you know, it makes a
That
big.
are
Child-
easy.
Childcare too. You want to
Right.
have babysitting so that they're not worried about what their kids are doing.
Yeah. That was something we learned early on when I was here is, you know, at UAMS, like that's such a humongous campus and we have tons of buildings and everything, like asking somebody to come to one, I have a hard time getting around UAMS, so that probably doesn't work for a lot of people that aren't familiar with it. Go ahead, Danielle, you got your hand up.
Yeah, I mean, with trying to host groups like this, one of the things that I've come across is people are often very particular about food. And that was something that I got into a lot with my previous supervisor, is like she always wanted to order like healthy food. And then like I understand the urge being community health. That's my department, but we were just wasting food because no one wanted it. And since we are on a very, very limited budget, and honestly, my budget got cut even more this year. So I don't know. I haven't been hosting groups because I haven't had the funding to do like good food essentially. But yeah, I mean, like having salads, having broccoli, having stuff like that, stuff that people aren't necessarily like familiar with, like they might not be having these regularly in their life. And yes, Sharish, like culturally appropriate food too.
Yeah. That's a good point.
That can be like another barrier there. It's like you're kind of showing that they're like, you feel like you're wanting something different than they are, or you have a kind of a paternalism where it's like, this is what's good for you versus what you actually want.
Yeah. Any other thoughts before we move on?
Culture appropriate food. Yeah, I agree. You know, it's something, yeah, you want people to make sure if you provide the food, people actually can eat the food.
Yes, Sabrina mentions working with existing groups, so we have patient family advisory councils, but what is unfortunate about at least our groups is they're not always, a lot of times they're retired nurses or people who engage like with our hospital a lot. And so they don't have some of those people who are more likely to struggle in our patient and family advisory council. Still can get some good feedback though, for sure. Y'all have some great ideas, but in the interest of time, let's go ahead and move on to our next bucket. And Anita will start us off.
Yeah, so next step we want to do is gonna want to talk about how to engage our participants. So we want to we want to make sure that our participants feel comfortable when joining, the sessions, whether it's like in person or virtual, make sure as soon as they join, greet them, talk to them. If they're new participants, say thank you for participating. I know this is your first time. We're so excited to have you. If they are participants that previously participated, just kind of have a small talk with them. And this kind of leads me to my next point. Engage with them with an icebreaker as you wait for everybody to join the session. I usually talk about the weather. I think the weather is a great subject to, kind of talk about, or the day of the week, if it's a Thursday, it's close to the weekend, or it's just a Tuesday, just kind of, make them feel comfortable, kind of create this like pleasant atmosphere, just kind of get ready to set up for the discussion. Another thing that we recommend is to use specific language just to kind of set the expectation. Make sure that they know they are there to be the judge and that we need their honest opinions on the material. And for that, what you can do is you can use ground rules. This can be co-develop or set in advance and ask for agreement to them. And maybe there can be other additions to the existing rules. So here are just some kind of our ground rules. They are no right or wrong answers. This kind of opens up the possibility for everybody to express their opinion. We ask for people to respect others' opinion. There might be some disagreements, but everybody's entitled to their own opinion. We want to make sure that we give everyone in the room or online to kind of express their opinion. Some people are more introvert, some people are more extrovert. There's always that 1 or 2% in the group that just kind of tends to take over the conversation, but what I do, I kind of start calling on people, and this way I make sure that I hear for everybody and I get everybody's opinion. We want to make sure there are no stupid questions. Any questions that they might have at any point, we want to make sure that they ask. We want to make sure that it's clear. We want to make sure that we give them instructions and they know what to do. And then what we have our Vegas rule of confidentiality. We said whatever is said or happens in the focus group, we ask them just to kind of keep them in between, just because some people might share their own personal experience or stories or something very personal. So we ask not to kind of share. And the next one, the next tip is kind of about asking questions. Use neutral, open-ended questions that invite participants to share their experience without a judgment. And some of that, it can be, we'll say, what about this handout or specific word is hard that we could make it easy? Also, keep them natural. Kind of try to avoid, wouldn't you agree that this section is hard? In here, you're kind of like implying that answer to them. So just kind of try to keep the questions natural. Focus on the material and not the person when discussing confusion or misunderstanding. Avoid questions that diminish the participants or judgmental or anything around in that area. Make sure you get clarification. If it's something that it's hard or it's something that you don't understand, just to make sure that everything is explained correct. Just kind of get participants to make suggestions for the questions. And so when we don't ask good questions, we can create shame and embarrassment without damages trust, and then we can make our materials any better. So instead, we want to get clarification on what we made hard, so we know how to fix it. Like I said, a good thing is to get a suggestion from participants by asking them how they would describe this in their own words. And sometimes what we might get not be exactly what it is. So that's why we needed to help us get started. We have another breakout session coming up. On this one breakout session, we are gonna focus on creating some questions. Katie and I will float around. We will give you a handout about HIV, and Katie put that in the chat. We want you to pretend like you're planning a field testing session to test these materials. So as a part of your planning, you need to create some probing questions to have handy to help guide the discussion. So in your groups, we're going to go back in the same groups. In your groups, we want you to review the material individual and then work together to create a list of questions. So let's try to aim for
Maybe 5, because we might
Okay.
not have quite as much time. We're a little bit
Okay,
behind.
so 5 minutes.
Yeah,
Okay.
maybe 8 minutes total,
minutes,
so some
okay.
time to, so you can create them about anything. Just remember the stuff that Anita has talked about. Try and create questions that help you like clarify the information and that would help you understand what participants' reactions to the content might be and would help you address any gaps in information. And I just want to say that I know as like health literacy and plain language experts, you might be tempted to start editing this content, but just try and stay like focused on task of like creating those probing questions. I'm gonna put these instructions in the chat as well for you, I think.
So let's kind of go by time because there was some people that maybe didn't on the second one. Let's do 2 minutes of like individually reviewing the material. So we're gonna have 8 minutes, so 2 minutes to review the materials, and after 2 minutes, y'all can start with creating the questions.
Sorry, the instructions look wonky. There's like 1, 2, 3, and then there's a sub list of 1, 2, 3. But Zoom won't let me format it in the chat. I'm sorry. I think we're ready though. I see people coming back.
I accidentally hit leave room, so I didn't mean to do that. So,
Okay, no worries.
I did the exact same thing. I was like ready to say something, and then all of a sudden I like left. Yeah. I was trying to get the block off my screen and hit leave, and I didn't mean to do that. So I didn't do that either, so I left my group hanging.
Happens. I have trouble moving between rooms sometimes. Like I'm always having to be extra special sure that I'm hitting leave room and not leave meeting.
Oh my gosh, I did that once.
I've done it like
I did that once, left the meeting.
Like, whoops.
Oh, I'm the facilitator. I just left the meeting. Ah.
Well, it looks like everybody's coming back. So I think what I saw is like, this is hard, right? How was it? Oh, so Sean has some putting in the chat. I love it. What about this handout is hard that we could make easier? What would help make this easier to understand? If you had to summarize it to a friend or family member, what information stands out to you? What do you think is the purpose of the material of that? What format would you think this would be best in? We talk about like process questions a lot too. Like those are kind of maybe beyond of something that you even thought about of like, how would you want to get this? How, what's the best format for you? Are there any images that would help you understand this? I love that question. I think I'm going to steal that. Is there anything that's missing that would help you better understand it? Any questions that weren't answered here? Anything still confusing? I love the question about, is there missing information? I think that's really important because, you know, we think that we've put it all maybe on the page and we didn't. What terms are you familiar with? What would you like to see changed? Y'all had some good questions. Did anybody find was this challenging or easy? Or maybe it was fun kind of working with the group instead. Okay. Well, we have about 10 minutes left together, but please feel free to continue to drop stuff in the chat. I'm sharing my slides, right, Anita? Okay. But we're going to go ahead and wrap up so we have a little bit of time for questions. Let me find my mouse. So during this workshop, we talked about the importance of engaging the right audience through testing and about some strategies to recruit and engage those who may be hard to reach, and then how to best plan for this session. And I want to go back to the Melinda Gates quote I introduced in the beginning. We really feel that by employing these methods that we're helping everyone develop and use their gifts for the betterment of all. And this allows everyone to contribute, and that I think leads to some meaningful change and gives people a purpose and something to kind of cling on to. And you all mentioned some reasons that this work is important, of making people, making your information more trustworthy, etc. It was great to meet with all of you today, and I hope that you can stay in touch with us. You can reach Anita or I at healthliteracy@uams.edu. Or if you'd like to, we have a monthly blog we send out. You can scan that QR code to sign up or visit our website. And here are our references. And we have 10 minutes left for questions if you have any, or any other thoughts that you'd just like to share. I'm going to
Hi.
stop share.
Hi, this is Carolyn Catilli. One of the biggest things we have with Inpatient is trying to get audience members who would be the most challenged health literacy wise. You know, they're not volunteering for a PFACs. They really most times just don't want anything to do with us. So I don't know if anybody has anything, you know, it's one thing if you're focusing a community group and maybe you can go where that group is, et cetera. But, you know, our community is, I'm a tertiary care place at Penn Medicine. I mean, we have anywhere from PhDs to individuals who are struggling, you know. So I didn't know if there was any suggestions at all of what do you do with that population? How do you find that population to get feedback from? Most times I have PFAC members that I ask them to be less health literate and, you know, to try to compensate because I can't get anybody else to volunteer.
I don't have a good answer for your question, Carolyn. I'm so sorry. I would be interested in the answer too. We're not in charge of our patient family advisory councils at our institution, but I do have a good relationship with the group who is, and we've talked about this before, and I think they've run up against the same challenges. It's like, how do we get these people engaged? I think that one of the challenges they've had is that they'll find some that are that say that they're willing to come and help, but then they don't show up. So it's kind of how to get them through the door. But they've recruited them. So we do the health literacy screening question in our in Epic. And so that's how they found those patients. They ask them all of our patients get asked that CHU screening question that Anita mentioned before. And that's how they've identified them and invited them, but then they just tend to not show up. Anybody else have thoughts on that? Love to hear them. Sabrina says in the chat of working with like adult literacy or English language learning classes would maybe you could engage them.
Actually, so that's interesting because I worked with the Literacy Center in West Philadelphia. But it's tough for them because, you know, you have competing health systems and I went into it with them saying I was hoping that some of their learners could help us, you know, make material easier, but we just never got to that reciprocal relationship. It was more that we came and went and worked on health literacy with their students. Not that they were able to give us feedback on, certain information. So it's a great idea, just in our case. And I didn't want to be too pushy, because I was there volunteering. I wanted to be the good part of Penn Medicine that, is there to help, not pushing the reciprocity that, oh, can you help us look at some of our documents? So great idea. I just don't, maybe a different organization would be operationalized differently.
Yeah. Any other thoughts or questions? All right, well, we're happy to stick around for another 7 minutes and answer any questions if you want to stick around. But otherwise, it was great to meet all of y'all and get to talk to you about this comment or this content. So Sabrina also mentioned paying them for work that might help. Yeah, so providing those incentives. I don't think that our patient family advisory councils provide incentives, and I think that it's kind of, for them, it's been a funding issue, but I think that would probably help. Yes, Emily, I think that's a good point. You could employ some of these strategies in like a talk aloud session or one-on-one type interviews. Obviously, you could find the right people for those one-on-one interviews and still use some of those strategies that we mentioned. Yeah. Keep using key informant interview style. Any other questions? Well, thank you all again for a good session, and feel free to, if you don't have any other questions, you're welcome to move on to the next one. Yeah, we've done some of those too, Sabrina, the going into a waiting room and getting feedback on materials. That's been helpful.
Yeah, I
go
did
like,
that a while ago, but that was a lot of fun. It was helpful.
we'll go to like our UAMS has like a student-led free clinic and go to that waiting room, and we'll carry around, like, they have these things that you can use in our hospital at vendors, like they're called CLIN cards, and so they could come into like one of our cafes or something and use it. And so we just sit with them for a couple minutes and ask them a couple of pointed questions, and then give them like a $5 or $10 CLIN card as an incentive for hanging out with us.
Yeah, there you go. Well, thank you very much
Yep.
for this session.
Good to
People
see
like
you.
the interactive part.
I like being interactive.
Yeah. People do really like that. So that's great.
Good.
All right, thanks.
Thank you, ma'am. Have a good one.